Yeah, just continuing with the intervention.
Yep. Okay, so we had a good question. The question was, if somebody does that extensor thrust, how do you go about continuing treatment? Does that mean transfers aren't something to do with that patient? And the answer is no. Transfers are absolutely what you need to be doing, but you have to teach them a different way to do it. So for orthopedic patients, pushing against the chair to scoot hips forward works quite well. For a neuro patient, it doesn't. So you will have to go back to teaching your patient how to shift and scooch a hip forward at a time, maybe providing assistance at the posterior aspect of the pelvis to shift each side forward, and keeping them in some amount of flexion to avoid that extensor thrust. So from there the question came, so what happens if you can't get them back in the chair because things happen so fast? And because of my finger, I am not going to demonstrate it, but Josh has agreed to be coached through it. And Mike has agreed to be the patient, so we're going to let, just for example, coach through this. All right, so what you would do is, and if you want to, you can put a gait belt on him, or you can use his pants. Probably a gait belt would be easier right now. Now that you're all pros at gait belts. And I'm sorry I generalized. I did say all of you were doing this wrong. Not all of you were doing it wrong. Some of you were doing gait belts incorrectly. Okay, so I want you to kind of control the extensors piece of it so that you're sort of legs straight and booty on the edge. All right, so as he's doing that, what you can do is either straddle one leg or both,
Okay.
all right? And then you are going to let him, so try to come forward a little bit. If you can't, then as he goes down, you're going to just slow that progression. And you can ask him, you don't want him to put his arms on the armrests because you could dislocate shoulders anteriorly
Good.
with that. So maybe see if he can cross his arms.
Cross your arms on the chest.
Yeah. And then as they come down, you're just going to ease him to the ground. Yeah. And then protect his head. Once his behind is on, you can pull into that flexion if you can.
Okay.
And because now he's pretty supported, you could probably get him into a sitting position if you can get behind his shoulders. So long, but yeah, there you go. Yeah. That's how you would do that.
Can you cue him to maybe bend the knees out a little bit for a wider base support?
Most of the time, you don't have time for that. This was like slow motion.
Yeah.
You don't have time to talk somebody into bending their knees. And if it is true extensor thrust, then you're not going to be able to, they won't be able to break the tone independently.
Okay.
All right? So that's it.
So